It's 8 o'clock and good evening, everybody. Welcome to today's episode of Marvelous Medicine about navigating career challenges for women doctors. There is Dr. Kalyani Narra. She's no longer a newcomer to Marvelous Medicine. She not only spoken on Marvelous Medicine, she is also regularly logs in as audience. She's an assistant professor at the TCU Burnett School of Medicine and Hematology Oncology Physician at JPS Health Network, Fort Worth, Texas. Kalyani did her MBBS from TIFF Pondicherry and a residency in internal medicine from Drexel University College of Medicine. Subsequently trained in laboratory research in Fox Chase Cancer Center and did a fellowship in hematology and oncology at Temple University Hospital and Fox Chase Cancer Center, Philadelphia. The clinician deeply rooted in community practice and has built an exceptional research portfolio outside traditional academic pathways. Her work has transformed care delivery by expanding access to next generation sequencing, clinically validating AI in lung nodule detection. Recognized with the Clinical Impact Researcher of the Year Award, Aim Ahead. Passionate about nurturing young researchers, and Kalyani has mentored numerous students whose work has reached national oncology and research platforms. The minute I, suggested this topic, Kalyani just pounced on it and, it has scheduled for today. So thank you, Kalyani. Moderating the session will be Dr. Gayatri Balachandran, also not new to Marvelous Medicine. She's been part of a panel discussion before. She's a liver transplantation and hepatopancreatobiliary surgeon based in Bangalore. Gayatri, Kalyani was totally shocked that there could actually be women transplant surgeons. Gayatri did her MBBS and MS general surgery from CMC Vellore and her DRNB surgical gastroenterology from Sakra Hospital, Bangalore. Subsequently did her LTSI fellowship in liver transplant and HPB surgery from Rela Hospital, Chennai. Received the IHPBA International Traveling Fellowship. She has publications to her credit. And among, other than being on the editorial board of many journals, she's actually the founder member of Women GI Surgery and Liver Transplantation, call themselves Vigil, and advocating mentorship and visibility for women surgeons. Thank you, Gayatri, for agreeing to join us today.
Thank you, Dr. Vidya.
Last but not the least, we have Dr. Sivaraman Ganeshan. He's a psychiatrist working at the Government Vilupuram Medical College and Hospital. The Kalyani's batchmate from MBBS from Pondicherry, and he did his diploma in psychological medicine from Madras Medical College. Postpartum depression is one of his special interests. Over to you, Kalyani.
Thank you, Dr. Vidya, for introduction and opportunity to talk about this. After last week's Dr. Thangam's talk, like I am nobody to talk, but I'm gonna do as justice to this topic. Okay, let me share my slides. So the topic that was given was navigating challenges faced by women doctors. I put in the heal, lead, and thrive because that's what we want all of us to be: healing, leading, and thriving. Okay, so the career slope. So back in when I was 25, when I came to the US, I was 23. At 25, like I imagined myself at this point, like by the time I reached 45, 50, I would be a professor, like head of department, some big thing. But the reality at this point is not like a linear slope. It's been zigzag. And I'm 46, so I'm still an assistant professor at TCU, and nowhere close to whatever I wanted. But then I thought, like, why did Vidya even ask me to talk about, what else, what did she see in me that she asked me to give this talk? So then I said, okay, what is the Maslow's hierarchy? We talk about career, and reaching the pinnacle of the career as if that is the final goal. The final goal, according to Maslow, is self-actualization, like reaching our full potential. So in that, like, we start from the physiological needs, then safety, love and belonging, esteem. At esteem, it's like respect, self-confidence, achievement, and then go to self-actualization. So then I said, okay, maybe I am still an assistant professor, but I think I have built myself to the esteem level, and maybe that's what Vidya saw in me, and I will try to bring the talk up to that. Yeah, thanks. So the specialty, like as women, in medical school, like men and women are treated the same. Like, I don't think it was the curriculum is any different or expectations are any different. But the reality is different. Later on, like the childbearing years are the main thing that is different. So like when we choose about specialty, what specialty are what kind of doctors are going to be. Nobody, I don't think in India also, like, there's nobody with MBBS only anymore. Everybody is a specialist. In the US, like, everybody has to do residency. So the personality traits determine, and also family circumstances. I'm bringing up this family circumstances because some doctors, if they have businesses or like their own hospitals already, that may determine like which specialty they're taking. But I'm going to give an example of like a couple of years ago, my classmate Chandrasekhar called me from UK and said, hey Kalyani, what you how many publications do you have? Like I said, I have 5, and he laughed at me. He has like more than 100. Then he came to Houston. We talked about things, and I said, "Hey, by the way, what does your wife do?" And he was like, "Oh, Chandrasekhar is a neurosurgeon." He said, My wife wanted to be a OBGYN in the UK. She came to UK to become an OBGYN, but then we got together and we married, and then she said we can't have 2 surgeons practicing in the family to raise kids, so she decided to be a psychiatrist. So, well, that goes. The specialty choice is dependent, on personality traits and family circumstances, and also, for decades, women have been discouraged from entering surgical specialties. That's because, like surgery demands standing long hours, odd timings, as well as being seen as a, man's profession, or that women cannot do. But I'm actually impressed to have Gayatri here and Vidya telling me that more than 50% of surgical residency spots are filled by women now. And just about the statistics, here in the US in 2018, women became for the first time, women became majority of both applicants and graduates. And 35% of active physicians in the US now are women, and but in surgical fields they are less than 25%, and orthopedic surgery it's only 5%. We all know from even in MBBS, like OBGYN, we had more women. That continues to be the case. Yeah, so I only heard about Dr. Muthulakshmi Reddy recently. My co-writer in the alumni newsletter, Dr. Ganesh Iyer, he sent me this and said, read about this, Kalyani. So I read about her. It's interesting that when she was the first woman to actually go into medical school, and then she was a surgeon, and she got Padma Bhushan Award later, and her son also became a surgeon, and she established the Adayar Cancer Institute. And I mean, nowadays we talk about, like, we are having this talk, but I don't know how it would have been like so many years ago when she entered medical school. Then that picture, the next one, Dr. Kadambari, she was the only surgeon when I was in MBBS, and I used to think of how does she even do surgery? But she's very involved in higher medical education and higher education, and that was a recent picture from last week. Then, as I was preparing for this topic, my classmate Sharda, she is a child and adolescent psychiatrist in the UK. She said, "Kalyani, this is a great topic. Nobody talks about. You should put these slides." So apparently, 2 years ago, two women surgeons in the UK came out and said that they were harassed sexually, and that came up. Then the NHS in UK started a survey and had 1,500 surgeons take that survey. And looking at this, I couldn't even complete reading this whole thing. That 63% reported of women reported being a target of sexual harassment, as opposed to 23%, and there is 30% sexual assault in women, as opposed to 6.9% in men. And then you're like, okay, this is current reality. This paper was published in 2023, and the women who came out, they reported their stories in 2021. So these are still in very recent. Then she also sent me this article, so which I was aware, but I wasn't thinking about the surgery aspect. But look at that. It seems long-term post-operative outcomes among patients undergoing common surgeries are better when women are the surgeons. So adverse post-op outcomes, including death at 90 days and 1 year after surgery, compared to those treated by male surgeons. Why that is, that we can talk about later. But Sharda is an educator, and she said skills-based training that can be evaluated objectively and being transparent and taking trainee feedback seriously, has led to many women taking the surgical path. This one in medical specialties, like if you think about, I am a medical oncologist, but at one point I thought about being a cardiology. In women in electrophysiology, cardiac electrophysiology is a fellowship after cardiology, and the doctor who wrote this, Kamala Tamirisa, she lives in the same community as me, and I don't know this doctor personally, but I've read about a lot of work that she has done and spoken in the locally, and it's she says that the women are only 13% of cardiac electrophysiologists, and this is the women in American College of Cardiology. They did this research and found out that women cardiologists are less likely to be married, less likely to have children, and only 13% of them have a spouse providing childcare at home versus 57% of men. So there is a big push in cardiology space to see how to get more women into cardiology and how to keep them, have a fulfilled life and career. So coming back to my specialty choice, I realized during MBBS that I'm not a surgical person, because you have to witness, like you have to react to the immediate feedback that you have in front of you. And I like to ponder about things, and I'm like, okay, I'm not a surgeon. I came to US. I told my dad, and I'm going to go to US and pursue cardiology and maybe win a Nobel at one point. So I was very determined during MBBS that I'm going to be a career woman. But when I was doing internal medicine training, then I realized that I have a deep interest in biochemistry, pathology, pharmacology, and all these new drugs that are coming, targeted therapies, are all in oncology. And I said, okay, I'm no longer going to pursue cardiology. I'm going to be taking hematology oncology as my career choice, a specialty choice. So this didn't sit well with my dad. He spent more than half of his life savings to send me to US to get me into residency. And then he was like, I thought you were going to be a cardiologist. I'm like, this is my choice. I love hemonc. You will see things, in many years maybe, but I stuck to that. Then I did residency, and that was all during residency time. Location of training is something that comes up as well. In my internal medicine residency, I had done laboratory research at Fox Chase Cancer Center, and I presented abstracts at cancer conferences. And I interviewed for fellowship at Memorial Sloan Kettering, Beth Israel Deaconess, Mayo Clinic, all these wonderful places. And I was like, okay, this is where one of these places is where I'm going to go, and this is where I'm going to be in career-wise. Then around that time, during residency, I got married. My husband does not have any medical background. He's in finance, and we lived separately for 2 years. And he moved to Philadelphia and got a nice job, and he loved his new job in Philadelphia. So he was like, okay, now like 3 years, you can't go to some other city, and I can't be here anymore. Like this is not going to be viable. So then I said, okay, I have done some. I'll just stay at Fox Chase Cancer Center, and I made peace. But it was a difficult decision to rank. Match happens, and then I was like, okay, should I put Memorial as my top choice or Fox Chase as my top choice? And I put Fox Chase. Okay, so then the 3 years of fellowship at Fox Chase Cancer Center, these are all my mentors. Dr. Burgai, he had 2 kids. Dr. Langer, 2 kids. Dr. Cheng had 4 kids. He was my laboratory mentor as well. Dr. Goldstein, who I adored, didn't have children. Like, she married late 40s. Dr. Seiden, he was the CEO of Fox Chase Cancer Center. I was lucky to be his mentee, and he had 2 kids. So it's you could see, like, why I'm showing this is that at the higher level in the academic training programs at that time, this is again 20 years ago, right? So there were not many women who were senior in the leadership and had careers and families. So the reality of what happened after what happens. So in medical school, we're all treated the same. Men and women are treated, but the biology of the childbearing years, the fertility, like you can see it here on the slide, the fertility starts declining from 22. That's the baseline they put in, and all the way to 32. It's declining, but it's not declining as much. But significantly starts to decline at 32, then rapidly declines at 37. But these are the years that medical training is happening as well. And it sounds like both of them cannot be postponed, but what do we do? So the average year of the graduating female medical student in the US is 28. So India is lucky, I guess. People I graduated at 22, 23. That's kind of normal because we start medical schooling really early. But here, that's 20. 28. Then you have multiple years of residency, multiple years of fellowship to add on. The 24% of women trainees reported being given a diagnosis of infertility at the average age of 34, and it's twice the general population. And for women surgeons, it's even later. Delays at first birth is happening due to longer surgical training. I took 1 year break between my residency and fellowship. I spent a year in the lab. I realized that I can't do both lab and clinical practice. It's not sustainable, and it gave time for me to enjoy my first pregnancy, and 3 months took 3 months maternity leave and started my fellowship. The first year of fellowship was not that hard, but then decided to have another child in second year, and that was a tough year with heavy clinical load. On-call weeks had to be staggered to allow for maternity leave, and then there is this comparison with the IT folks. Um, that's that's another challenge, because the training, your salary is not that much, and then you are working very long, and then you're compared to the IT family members, mm, which happens. That's the society, does it. Then I was diagnosed. This was the lowest period of my time. I was diagnosed with postpartum psychosis after maternity leave ended. Mm, and then that was then became postpartum depression. This Why did this happen? Like, what could I have been done? Like, what could have been done? Those, we can talk about that. But most majority of that was sleep deprivation and schedule at work, which wasn't decreased, or I didn't ask for decrease because I didn't know how to ask. But there, I guess, like several weeks, I went without sleeping at all, and to keep up with the work and the demands of the childcare. So, bringing about the postpartum depression, here uh, in this report, again, this came out only in 2022. Back then, when this was in 2009 when I was diagnosed with postpartum depression, I don't think I even heard anybody having it. So I had no awareness at all, and nobody even, like, during the prenatal visits or after, nobody even asked about things. So it was just expected that the child would be born and then you get back to work. But now, like, there is some awareness, and 42% of female, these are trainees, responded that they suffered from postpartum depression, and most of the reasons being fatigue, emotional distress, and leaving infant, breastfeeding, pumping accommodations, concern about partner well-being, daycare, childcare issues, feeling academically behind coworkers, guilt associated with colleagues covering your caseload, and yeah, so there were these are all the stressors that can lead to postpartum depression. Okay. So yeah, then this is another survey from the cardiologists, and they looked at, this was again published a few years, 2022, what happens to how many women had pregnancy-related complications. So among 300 plus respondents, 38% of women cardiologists had pregnancy-related complications. And taking extra service or call, having pregnancy complications, salary decrease, they said was that impacted their career adversely over time when they analyzed these patients. And being in the academic setting, salary decreased for 29%, and private practice, 67% reported their salary decreased. From my healing journey, so that's my psychiatrist. She's a godsend, and Dr. Bishamshar, she specialized in trainee mental health issues. So when I was assigned, because I was still in training, right? So the training program said, they called my husband and said, she has to get permission, she has to be evaluated. So I'm talking about this now. This is now 16 years after the start of that, but it took me a long time to actually come out of this, like get over the stigma and shame associated with it. That she said, okay, Kalyani, like everybody, like including my family members, told me, you should just quit. You should, don't think about work, career. You're a mom. You have 2 kids. You should just stay home and take care of kids. Your husband has a good career in finance. You don't need the money. Yeah, all that. She said, Kalyani, I will tell you how you can keep your career, or how to, you don't want to waste everything that you did all your life to get to where you are. in terms of skills and knowledge and that from a medical standpoint. She said, I will be your support. Okay, then I totally trusted her. She put me on medications. It was on lithium in the beginning, but I now don't remember. Seroquel, lithium, like some Zoloft for like 6 months. But the main thing was I felt the trust in her, and then like learning to live. So and she said sleeping, eating, and exercise. These are more these are more important than anything else for now, because you've exhausted yourself like just with everything, or over the last 6 months or a year. So now you have to learn to start taking care of yourself. So I took off, or I was made to take off for 3 months. Then um, went back to work, and finished my. It took another year. I had another year of training, and finished the training, and then took a job in the local area, because my husband was had a good job in finance. And so I said, okay, I'll just stay. Whatever job I get, I'll take. I started as a locums for 3 months, and then they created a position for me at the same place. And and then so talking to Dr. Bijam shared, like it was like, have I learning to live. Being a physician is only one facet of life. Coming from Jipmer and being this driven, I thought physician was the main or big aspect of my life, but having to learn that as a was a change. Then I had two more kids. I was working full time, but it wasn't like, I wasn't doing any research or anything. It was just taking care of patients. And it's a small community hospital. We had 4 oncologists, and they had 3. They made a position for me, so it was 4. Then I had 2 more kids without pregnancy complications. I was still seeing her like every 3 months or 6 months, to because she said, you cannot have any more kids, because with after the postpartum depression, there is a 50% chance of happening it again. And I said, no, I want to have more kids. My husband loves kids. I will make it happen. And so she was there throughout this. I didn't have to take any medications, but the one thing that helped was like journaling. So she got me into the habit of putting my thoughts down. And so those are all my journals over the last years, and taking, like, rekindling my interest in literature. I took a or I learned Sanskrit before, and Telugu, then dabbled in Telugu poetry. Then I wasn't big on like literature from English, but like Upanishads, Yoga Vasishtam, these are all, and Hindu epics, these are all the books that I started rereading them with emphasis on application to modern life. Then we had made friendships with more with non-physicians. I had became friends with a lot of non-physicians. Then I joined this Vedanta group, which is mostly by the Bengali women in Philadelphia. Then we like just the family life, focusing on that. Then, so couple, yeah, yeah. So the some books that really helped me was these 7 Habits of Highly Effective People by Stephen Covey. There's three habits. First 3 habits are like how to be independent. The other 3 habits are how to be interdependent. So interdependency is where how to be interdependent to raise a family, how to be interdependent in teams when working with colleagues and patients and nurses. So that book was very good. And then my husband introduced me to these books, one book by Laura Vanderkam, who is an author living in Philadelphia. She's a Princeton graduate. And at the time I read this book, What the Most Successful People Do Before Breakfast, she had 3 kids, but she's not a physician. Then she wrote a few more books. I know how she does it. And then there is one book called 168 Hours. You have more time than you think. So this journaling, she also advocated journaling and like counting or accounting for time. And I read all her books, and then started following her blog. And Then what I understood was how we as physicians look at time versus other professions view time, and how employers view our value. Like as a medical oncologist, I may see a patient who is young patient who I want to do everything that is possible. There is standard of care, but I'm only going to be paid for the time that I do the standard of care. But I'm probably thinking about that patient for 2 more hours, talking to some colleagues outside of the area, like experts, and listening to their lectures and trying to find out how best I can treat the patient. But that is not the value. That is not how my employer views the value that I'm providing. So then just trying to be aware of the cutoff, like aware of this was a big change as how I thought about, not that I didn't start like doing that extra step, but at least I became aware of it. And other professions, like other professions, most IT and other professions, they are looking at, okay, it's an 8-hour day. We as physicians are not to look at that as an 8-hour day. During medical MBBS, during training, it's like you have 24 hours, like you are a physician, 22 hours, like sleep for 2 hours and then go back. So but they are very okay if that our time is 8 hours. If I worked extra 4 hours, I will be asking them for 4 hours extra pay. Like, this is not how medical training is. Then yeah, so here I want to bring about, like, yeah, so this by this time I had a job, and I was getting paid more than the training, so I hired a nanny. We had daycare, we had school, I had parents come in and help me, in-laws, grandmother also helped me, we had friends, and sometimes, like, Philadelphia, it would snow, so I would just take my kids sometimes to nurses, grown kids. It's like, please take care of my children, because even the nanny is not able to come today. So it takes a village, and I started learning to ask for help, or how do I get, how can I, that was one of the issues before, was like, I was not asking, I was thinking I need to do everything by myself. No, you have to delegate, you have to learn to ask. Okay, so then after in 2018, I moved to Dallas, Fort Worth. My husband said, I'm done with this job in finance. I want to be an entrepreneur, start a company. Texas has better rules, and we are moving to Dallas and Dallas. So, okay, I got this position at JPS Health Network, where I have been here since 2018. Then life gave us another thing. So my youngest one, was diagnosed with autism. Thankfully, one of my classmates, Madhvilata, she came. She lives in Vijayawada, but she came to visit, and she said, "Kalyani, something is wrong. My son was not even 2 years old, but she saw something, and we got him evaluated. Early intervention helped. We got into ABA therapy, and thankfully, I mean, we were told that there is an 80% chance that he's not going to become normal, and we were like, my husband and I, we would like, okay, our life for the next 2 years, whatever time it takes, is going to be on getting him back to, like, reconnecting his brain and making him talk. So our family's focus became adjusting. All my older kids also started working with him, adjusting his neural circuits, and in 2 years, he was back to, by 5 years, he's back to regular public school, and he's doing well. And nobody, I guess I'm putting it out here, sharing this news, but they're sharing this diagnosis, but at school, nobody knows. Yeah, so then 2020, last 5 years, I've been at work. In addition to patient care, I started doing some quality studies, then established collaborations with collaborations with the universities next door. And outcomes, started working on outcomes research, did a AI fellowship, and brought clinical trials. All this as, like, my interest in research, or like being passionate about this. These were all not part of my regular job, but I was like, okay, I want to do this. So in 2024 at JPS, I was given this award, Clinical Impact Researcher of the Year award, and then 2025 first place. That's Paras, my colleague, and me at the Quality Fair, first place for our lung cancer, lung research, lung nodule research. And so then that's Dr. David Gerber. He became my mentor. He came to me, my office 2 years ago, and he said, Kalyani, you're doing all this. You're doing more than what we do in academia. You should start writing these papers, like writing this up as formal publications. We'll come to that. So then recently, a few months ago, my work, I was named for as a medical research finalist by this Dallas CEO magazine. So that this is all what I was doing as passion for the last 5 years. So yeah, then in June, I'm going to Minneapolis to talk about my AI work. Yeah, I got a 30-minute oral presentation time. As part of the outcomes research, I started mentoring medical students locally. So the 4 medical students here are from TCOM, which is an osteopathic DO school. This student, Bottom, her name is Priska. She's a TCU medical student applying for residency now. And Sushmita is my JIPMER batch of 2017. So she became my mentee, and we went to a conference together. I did want to highlight how I was able to integrate my passion for science and research as a mother. So that's my oldest child. That when he was in first grade, that was his science experiment, cleaning coins using using tamarind. Then this is him. Last year, he presented a poster at one of the interventional bronchology pulmonary conference, and this was the work from our work at JPS. So, and Vivek and I are co-authors in 2 publications now. Then that's my first older daughter. Like that was she was the one when I delivered and had postpartum depression. She has a scientific mind, and she came to me when she was in 7th grade and said, "Mom, it's not challenging. School is not challenging. Find something for me." So I started getting her exposed to several academic competitions, and she her CV, like a couple of years ago, her CV became longer than mine. She's in 11th grade now, and then that made me think about my career seriously. Here, then I was doing things individually, and then there were other students from the school. That's my younger daughter, Sneha. Other students from the school, from middle school, they started coming to me and said, "Can we call you coach? We want to participate in the competitions that you are making your kids take. So can you coach us?" So then I started coaching these kids, and the team won 4th place at National Biology Bowl. The science teacher, she's not in this picture, but she and I became co-coaches. So where am I? I've been a medical oncologist since 2010. Doing patient care, general medical oncology. Then last year I finished AI fellowship, and then I've been doing outcomes research for 5 years now. Then since 2024, like 2 years, established clinical trials as a big part at JPS. So that's I mean, for a long time, 2010 to 2020 or so, like I really didn't. I just kept the job, but then over the last 5 years is when things started accruing. Then over the last couple of years, like got involved in JIPMER alumni, mentoring graduates, JIPMER graduates in research, establishing collaborations with JIPMERites in the US, growing alumni network, started newsletter with Ganesh Iyer in January. Then with Sham Vishweshwaran, I started Research Careers monthly meeting. This we only had one session so far, and Ravi Shankar was our first speaker. So let me look at the time. Yeah, maybe 5 minutes. So the mastery. Yeah. So this somebody sent this to me, and I was like, okay, how do I? What did it? How does it? What does it mean? So for me, it was like, okay, I was in comfort zone when I had the job. Like you do the job, like you get, yeah, you're feeling safe and in control. It's the same thing that happens every day. You get better at it. Then fear zone. A few years ago when I started doing these research projects, and I had to actually learn Microsoft Word after not even doing anything for 10 years. That was one of the big things. And then when Dr. Gerber, my mentor, came to me and said, okay, you have to start writing papers. I was like, how do I start? That was the fear zone. What will people think? I am in my 40s, and my academic peers who didn't take any breaks, they are already professors, and I am, they have like hundreds of papers, and I am just starting. And then I said, we have to start sometime. So I was like, I started separating myself from, this is the skill that I don't have. I have to acquire the skill. um, and I may be good in some part, but I am not in this. So how do I acquire skills? So the fear zone, coming out of the fear zone, then learning zone, then I feel like right now I am at this growth zone. And so it became job to career, but at some point it'll be a calling. And next, I was like, okay, how do we apply this Maslow's hierarchy of needs to the workplace? Last year, one, it's after the social needs at work are met, like teamwork and camaraderie, then you start looking at esteem needs, like recognition for achievements and opportunities to lead. I was fortunate, like 2 years ago, one of my colleagues, pulmonary colleagues, Dr. Baramosi, he was chairing one committee, and he got promoted to the chief quality officer of JPS Health Network. And he came to me and said, Kalyani, I want you to become the chair of this committee. So that then that's esteem, like recognition and opportunities to lead. These are how like how the leadership development happens. It's still work in progress for women leaders, or women bringing that to women and making them grow. So at this point, I feel like I'm in this. This is a Japanese concept for the reason for being called ikigai. So when there is a blend of passion, mission, profession, vocation, everything, then you are in the middle. That's called the ikigai. I feel like I'm right at that position now. I get paid for I love what I do. I am good at it. I get paid for that, and there is a mission to it. So coming back to this policy, this is American Medical Association. The policy here, they said 80% of female physicians become mothers. Postpartum depression may occur up to 12 months, not just 3 months or 6 months after delivery. Then general population, 6 to 20% of women develop postpartum depression, but the rate is 4 times as high in resident physicians. And so as the in 2022, 55% of women graduates are women, and these all have to be taken into consideration, and they're coming up with a policy for pregnant and postpartum mothers. This is from the cardiology. Again, Kamala Tamirisa, she led this one workshop, and it became what policies are to be implemented in the workplace, and to have a full life for women. Here, she reported 38% of female cardiologists have pregnancy complications, for the infertility, 1 in 4 physicians, and that all these the policy, like professional societies, also have to come up. I mean, individually we can do, but professional societies are also coming up with some action plans for this. And then coming to the women surgeons here, the sexual misconduct in surgery, again, Sharda sent this, and NHS in UK, they are working on eliminating, or you can't really eliminate, I guess, but decreasing this as much as possible, and offering flexible training in surgery. So if the trainees don't want to work full time or work less than full time, then they have that ability now. What Sharda said is the current generation of 20-somethings seem quite self-aware, are attuned to their strengths and weaknesses, and choose their specialties based on their likes and dislikes rather than what is expected of them. So in conclusion, careers are long, but childbearing window is narrow and inflexible. That is something that I'm passionate about telling all my medical students who round with me for research. I don't know if I should be telling them, but I actually tell them that think about this. You are in medical school, you're thinking about residency, fellowship, but also you have to think about the childbearing window. And complications during pregnancy and postpartum period for women trainees and physicians are much higher than general population, and postpartum depression needs more awareness and less stigma. It took me 15 years to come out of that shame to actually talk about this, and the reason I'm doing it is I have 2 daughters, and all these medical students that are close to me, and I wanted to tell them that the diagnosis itself is, that doesn't have to limit you from what you can do later. And women physicians can thrive in all specialties, including procedure-related specialties, which I showed, electrophysiology and like EP cardiology, as well as surgery, while integrating work and life. 9:17. Okay. All right, that's about it.
Thank you, Kalyani.
Thank you all for listening.
Gayatri, would you like to come in now?
Thank you, Dr. Kalyani. That was an honest and really very powerful talk. You willingly shared so many details of the highs and lows of your life across your career. And I'm sure there are many in the audience for whom at least parts of your journey would have definitely resonated, men and women alike. I think, it's a problem, what we call this work-life balance. But I think integrating work and life, I think that's the key, and that's one important takeaway of how you've been able to balance both.
Gayatri, I couldn't hear your image is stuck. Your picture is stuck.
Dr. Shivaraman, have you figured out how to turn your camera on? Otherwise, I think Gayatri is having some problem with her network. By the time she sorts that out, if you want to add something now.
Hello?
Yeah, Gayatri, we can hear you.
Oh, yeah, Gayatri, now we can hear you.
Yeah.
So I was saying that I found interesting that Dr. Sharda, I believe, said that people in their 20s nowadays, they're much more self-aware. They know what they want. I think something that I feel is that the norms, so many of the these invisible pressures that are felt on women, that we should be the primary caregivers, we should take the less demanding profession, we should, in compromise for the sake of the family. Do you think some of these norms are changing? Men are, are equally, if not, they're also concerned about work-life integration. They also want to take part in parental roles. Do you think that has an impact on women in physician roles?
Yeah. So, yeah, Sharda said 20 something, they're much more self-aware. I can see it in my children too. Like, my children that are growing up here, like they can tell me what they want, whether they want to do something. If I say do this, when I was growing up, I would never say no to my parents. But these kids are, they're like, Mom, I can only do this. I will do it later. So there is that. I can see that these kids are much more self-aware, and they can tell the boundaries. They're not that lax. And the medical students here that I see, they also tell me, okay, Dr. Nara, I can only do these 2 weeks. I'm busy. I can't do this. I will do it in March, so and so time. And they are somewhat. And one of the differences between the medical students here and these medical students are a little bit older than when I started as a medical student in India. That's one. So they're more mature about things. About whether men are having, yeah. So there is, I mean, men also have to raise kids, also have to take care of families. In general, I think this work-life integration, work-life, it's much more talked about preventing burnout. That's all. These are all being talked about now, much more than back when I was in training. These are all good things because when I guess when I was in my MBBS, people were like 50 was the end of life, or that's how it felt like it, or people would just talk about 50 or 60 was end of life. And people now live, normal lifespan is 80 plus, and so, and physicians work until like 70s, right? So the careers are long. That's what I want to emphasize. Is not like we don't stop career at 50. I mean, medicine careers start at 40. Our actual job starts late. So then you have so many years to reap the benefits of it. So that's like in taking a long-term perspective helps.
Another thing that I really liked what you talked about was, which actually I can personally relate to a lot, is how you realize that you have to ask for help. As women, I've talked about this before, we tend to have this superwoman syndrome that we can do it all. We are supposed to do it all. That's the mark of success, if you can juggle 10 balls at once. But I think it's a path to self-destruction, trying to do everything by yourself. And like you say, it takes a village. And something I keep saying again and again, for women surgeons, it takes a city. It takes a whole lot of support. And you have to realize that there are some things that you just can't do. You can't do it all, and it's okay to not do it all. I think that's an important thing. It's not a sign of failure or weakness that you weren't able to make it to that dance recital, or you weren't able to bake chocolate chip cookies, or you weren't able to do every single case on your rota. So I think at some point you have to give yourself a break. I think that's a very important message. And not just for women, for men, but I think especially more for women, because we know somehow a lot more responsibility does invariably fall on you. So yes, I really like that.
Yeah, thank you. I mean, that's the tendency is that we want to be good at all and in everything, but you can't do all at the same time. You can do them so to understand that, it took a lot of self introspection and reading the scriptures to understand. When I was reading Yoga Vasishtam, and clearly, what is the path that Rama took, and what is the dharma, like what are his duties. And that was when I was like, okay, what is my duty now? What is the main thing that I want to show? Because I can do 10 things good, but what is the best one that I have to do at this time of, or this year or next year? Like, those that help clarify, um, and take things in a with a long-term perspective, and giving up. It's, when I also, it's also thinking about, okay, if I am employing a nanny to help me, that's giving her an employment, so that's a good thing. Okay, so it's not like some women, um, non-medical women, they're like, why are you giving your child to the nanny? Or my nanny has like 6 kids, so she knows how to take care of children, and my children will, in addition to me, like they will know other maternal figures, and let them get love and affection from others. So they used to think that if I hiring a nanny was taking something away from being a mother, but I had to take a different perspective on that. Same thing with, yeah. So yeah, we can see other questions.
Dr. Shivaram, would you like to come in now? Dr. Shivaraman?
Can you hear me?
Yeah, we can't see you though.
Yeah, I'm unable to do that, set right that glitch, but I will talk. Okay, ma'am.
Yeah,
Actually,
it's okay.
Dr. Kalyani, I'm happy to talk to you. Uh,
Yeah.
Actually, 1 year ago, was it that you crashed into our WhatsApp group?
Sorry, what happened?
It was 1 year
About a
ago,
year
was it?
ago.
That
Yeah,
you
yeah.
crashed into
So
our WhatsApp group?
2024 September was when I joined the WhatsApp group.
Yeah, it
Yeah,
was
so until then I
like
wasn't.
it has been
Yeah.
nearly what 36 years, huh? Or 26 years since our
Right. I mean,
2001 we
yeah, I
crashed out.
haven't I
Yeah,
haven't
yeah.
seen you.
Yeah,
2002 was when I left
you
Jipmer,
didn't come to
and
the
then
reunion. Did you come to the reunion? No.
no, I was
So
uh, totally away.
yeah, so it's a pleasure meeting you. Unfortunately, I'm not able to hit the glitch. Right, my video is not on. Okay, anyway, um, see, what Nara Kalyani we used to know then was totally different. Now you are so. In fact,
Yeah,
we have very few occasions where you had come forward both academically and cultural or sports events. I don't remember, but
right.
now
I didn't.
you
Yeah,
are.
I was totally
Yeah,
focused on academia back then,
yeah,
or
yeah, yeah, yeah.
academic.
You are a
Yeah, I
nerd.
didn't
You are a
take
nerd then.
cultural or sports.
Now, now you are totally a different person. Okay, so coming to the topic, um, as a woman and working is a difficult task. Being a doctor, a woman doctor, uh, and raising a family, that too 4 children, that too as a migrant in America, you have gone through so much. Apart from this, medically also you have gone through so much. You have suffered from the most severe form of postpartum illness, postpartum psychosis. It is a very
Mhm.
rare form, and it is very serious in the form that infanticide and suicide is very common. So you have really gone through such a difficult disease, and you have taken medication for that. Probably lithium you took, I remember, as you said.
Yeah,
Uh, it's a very toxic drug, and again also for 6 months, if I remember right.
Yeah.
So and you raised autism child also. So
Yeah,
all
yeah. I
this.
mean,
Uh,
now we don't even talk about, like, it's completely reversed.
okay, okay. So apart from the normal working woman, you have gone through all this, and medically also you've gone this, and uh, I feel, and you mentioned some harassment also, a mild form of harassment where you were denied uh, salary rise, remuneration rise, though you covered for your male colleague. So all this has happened, and still you are a. I feel Maslow would have been proud of you. Actually, when he formed
Thank
this
you.
theory back then, he had problems finding people who had all these qualities, like who had this self-actualization, no, who had achieved self-actualization. One of them, he says, was Lincoln, Abraham Lincoln. But he had problems finding people. He would have been happy if you had been there, if you had been here now. You had all the qualities. You are so independent. You are so creative. You are so open. Uh, and you outside your work, you are so dedicated to your work. One, then outside your work also, you want to contribute to the society, and you don't fall into a stereotype. You don't conform to stereotypes. And you have shown love and affection towards your family also. So all these qualities, he said, is not easily found in every many people. So Maslow would have been proud of you. Then coming to
Thank you,
the
Siva.
then then coming to this work life integration, as Gayatri ma'am has pointed out, rather than work life balance. Um, I want to know, like, how much did your husband contribute,
Yeah,
especially
yeah,
during
yeah.
your
So yes,
postpartum psychosis?
right. Yes. So like, yeah, I have mentioned before that he's not a medical person. Like, he like didn't know about Jipmer when I married him. My mother-in-law was a botany lecturer, so she knew about medicine and she knew about Jipmer, but my husband had no idea, even though he studied in IIT Madras. Yeah, so it was, but when it came to postpartum psychosis, he was the rock. Like, when they called him from, of course, he didn't anticipate, like, he wasn't thinking that something was wrong with me when I was not sleeping for weeks together. But he had like a finance career where it's a very intense schedule as well for him. Even though, like, his work was 10 hours, like, he had to put his mind completely on the work. And then he was coming and taking care of the older child when I was, yeah, when we were juggling. So he didn't anticipate all this. But then once they told him that I have to be seen by a psychiatrist, he was the rock. He got some time off, or took some time off. Then he called my dad. My dad came from India to help us. And then we had to do every twice a week appointments with the psychiatrist. And the psychosis was harder because nobody knew what to do. And it like she tried to keep it outpatient. Like, the appointments were outpatient. I probably would have been, another doctor would have been admitted me to the hospital, but she said we can take care of this as outpatient. And I think first appointments were like 2 or 3 times a week, and then slowly they became once a week. But yeah, it was intense for the first month or two, and not knowing. And they were at one point, I don't remember a lot of these now, but if you talk to my husband, he probably will remember. But they were talking about ECT treatment, because once the psychosis came out into depression, that depression became like so bad that I just didn't know how to face. Like, I after I went back to work 3 months, after I took time off for 3 months and went back to work, everything was new. I felt like I don't know anything. Like I had to start from zero and no confidence at all about anything. I even once, and the people were like, okay, I mean, they understood that this was medical, but once I had to give a talk in front of, it's just a fellows noon talk in front of like 50 people. I, I totally froze. I couldn't say a single word. Then I called my husband. I used to call my husband and tell, I froze, like, and he's like, that's okay, that's okay. So he was there the whole time, and yeah, and he is very good with the kids, and work life integration, that's all possible because he is excellent with taking care of the kids.
Dr. Jordan, Dr. Jordan Norbe, if you're there, would you like to say something? Jordan Norbu?
Hello, Mom.
Hi.
It's so nice that you're giving me an opportunity to speak out here. So, just to introduce myself, I'm Dr. Chodan. I'm a plastic surgeon, and I'm working in the state of Sikkim.
Oh, are you
I'm so
Jamyan's
amazed.
wife? Are you Jamyan's wife?
Yes, Jamyang made me
Oh,
join this,
nice to hear
and
from you.
he's been telling me that.
Jamyan is my classmate. He actually sent pictures of you and your kids. And yeah, he told me you're a plastic surgeon. Great, nice to meet you.
Right. I'm like, so, I could just, your talk was so inspiring, and I'm so touched, and I'm so happy that I could join this meet today. Jamyang has been telling me since, the time this thing was posted that I should be there in this meeting, and I really loved your talk. I could resonate so many of my own, you know.
Yeah, when he
So
said
Jamyang
his
is also
wife is
here.
plastic
I
surgeon,
wish.
I was like, are there women plastic surgeons? I know my classmate Ashita was is a plastic surgeon, but it's so inspiring to see Gayatri here and you coming to the talk.
Yeah, but these days, Kalyani, out here in India, there's a lot of surgeons, and most of them, a lot of lady surgeons. So it's so nice to
Yeah.
see, many of those lady surgeons becoming plastic surgeons as well. So now the ratio is almost close to 50-50.
That's what I'm hearing. I mean, anecdotally, this is what I'm hearing. Like yesterday, I was telling one of my nurse practitioners about that I'm giving this talk, and she said she was in trauma surgery for a number of years, and she said the surgical residence life is hard over there. She's like, one of the surgeons did 5 years of surgery residency. Then towards the end, she had a baby, and then she was allowed to take 2 weeks maternity leave because then they wouldn't graduate her, because her next fellowship was at Harvard, it seems. And the fellowship, they
Okay.
said they could not postpone her start date. So she took 2 weeks and then went back to fellowship. So, so I
Hmm.
don't know. And yeah, so you guys had to put up with a lot of things as well.
Kalyani, give me a
Also,
moment.
like I mentioned earlier, we also have Dr. Thangam on the call. Dr. Thangam, Narra, Kalyani would love to hear from you. Dr. Thangam, if you're still there. Actually,
sorry, yeah.
Oh, namaste.
Namaste, Dr. Kalyani. It was such an amazing story. My God. And you were having your doubt why Dr. Vidya chose you. It is not at all a surprise. My
No,
God,
like,
the ordeals you have been through, my goodness. It is really amazing. Really amazing. Hats off to you and to where you stand. And I think I feel the most satisfying thing, maybe in my perspective, is that your children are following in your footsteps and they're doing very well in spite of all the ordeals that their mother had to go through. It's wonderful hearing. So nice to hear this talk. Really wonderful. And like you said, yeah, my perspective on this is that in India, the medical education starts after +2 or after school, whereas in the US, it's a post graduation. You need to have a college degree first, and so they automatically they start at a later age. The
Right.
medical school starts later, and so that again goes against our our biological age and the age of our eggs and all that.
Yeah.
And
So
wonderful,
yeah, that's
wonderful
it's a big
hearing.
issue.
So, the Colonel Harikrishnan made a important point about, the so-called norms. So, if you'd like to speak that out, sir.
We can't hear Dr. Harikrishnan. I think you're muted still.
You got me there. Yeah. I was saying at the cost of sounding a little bit cliched, I must say that somebody asked a question about how do we overcome the gender bias and all that. I don't know that we should be talking about whether there is gender bias. We should be actually talking about how to overcome that. That was the point I was trying to make, because it's about time we realize that women in every field, including the fighter pilots in India now, they're on par with anybody else. So there's absolutely no reason they represent 50% of the population. They should represent 50% in any other field as well, if they're capable. And the same applies to men. Men just can't afford to become somebody of significance unless they are capable. I was just doing a little bit of homework while you were talking, and ASI says that they've got 4,160 surgeons on their rolls, which is an amazing 19.6% apparently of the overall workforce in terms of surgeons. I'm not talking about the total number of doctors. I'm sure it's way better. Whereas in the US, it's about 22% of women who are surgeons. So I think we're pretty much there, probably ahead in some ways, for instance, in terms of the number of people who are pilots and things like that. So we are definitely moving forward, and I sincerely hope we continue to do that. And people like you, who are an inspiration to youngsters, must work towards promoting that there is no reason to believe that because you are expected by society to contribute more at home, you can't be a good physician. I think that is the image that you need to shatter, and you're already doing it. I'm very, very impressed. God bless you, and may you do a lot more good work and encourage others to do as well. Take care. Bye-bye.
Thank you. Thank you.
Akila.
So Gayatri, I see your child. So that's the work-life integration right there.
Apologies. She
No
was banging
apology.
at the
Please
door
don't
for a long
apologize.
time, so I
No.
had to bring her around.
What's your daughter's name?
This is Malini.
Malini. Okay.
Hi,
Hi.
Malini. Akila, if you're still on the call, you had some questions and comments. Akila Ravikumar.
Hello. It was
Yeah.
quite a very inspiring talk, Dr. Kalyani. So my one question was like, do you think your experiences, I've typed it out, your experiences has made you a more empathetic colleague or a leader or a guide to your younger women doctors? That's one question to Dr. Kalyani. And I don't know if this forum has got some of our doctors, senior doctors from the government. But I find, younger colleague, the women doctors are having a lot of problems when they come back from the maternity or during their pregnancy. And they have this system of bond here where they are, have to serve in the rural areas and all. So it is not being taken as very well by the government, like, their certificates are taken, and if they don't come and sign, they are not able to get back to their jobs. So I'm not sure if there can be any help done to better the situation. But if there are doctors here who can take it up, it'll be well and good. Thank you.
Thank you, Dr. Akila. So to answer the first question about empathy, so it's the other way around. Other way around meaning, empathy. As a medical oncologist, I am naturally empathetic. That's one of my core qualities, that I am an empathetic person, and that's why I'm in medical oncology. To become a leader or to become a mentor, I actually have to reduce that empathy a bit. I mean, and um, set boundaries so that I don't absorb. If somebody comes in with a problem, I don't absorb their problem as mine, and have the set boundary. So that's what I am learning as I am developing, as a leader, is that yes, I have these core qualities, but then I have to acquire different qualities or skills to do the next whatever job is. So that is one. And then about the women in India, that is sad that you have. Yes, so that's
Kalyani,
Charda.
compared to the
Yeah.
United States, India in the government sector, it's a very one of the most liberal maternity policies, almost nearing European standards. So it started off as 6 months and now 9 months, and then they're going to increase it to 1 year. They've even added paternity leave. And so actually, obviously, anything can be improved on, but we are actually on a much better ground than many other places, especially United States, compared to that. And the other thing is, of course, like when the other problem is this conflict about when you want to take time off. If you take time off, obviously your graduation get postponed, right? That would be natural, isn't it? Suppose you're supposed
Yeah,
to
that's
suppose
about
you
the
have
graduation.
12 months of training, means you cannot say that because I was pregnant I will do 3 months and you have to graduate me. So those are all areas of problem, how to make it part time and how to give them more time so that they can finish but at a slower pace or whatever. So lot of work needs to be done on that. So perhaps we should have a entirely different session on that at some point of time, though we have alluded to it in a few other sessions before.
Vidya, I just wanted to tell Dr. Kalyani this. Dr. Kalyani, I'm sure you made your dad proud of you.
I think he's here. I saw my mom as a Zoom user sometime back.
Good
So
yeah,
he may be here. I don't know. But thank you. Yes, he's yeah. I have to yeah. He has been there. I mean, he believed in me when when I said I'm going to the US. He believed in me, and so I've always been thankful to him and my mom.
Dr. Tangam,
So
you have your hand up. You wanted to say something?
Ma'am,
Yes, ma'am.
Shivraman,
Actually,
I want to say something.
Yeah, go ahead, Shivraman.
Ma'am, regarding Dr. Akila's question, already in Tamil Nadu is way ahead. Tamil Nadu is already made maternity leave as 1 year. My colleagues are also taking it. And one more thing is, central government is still, even in JIPMER, it is only 6 months maternity leave till now. As you said, in other countries also, in UAE, all those countries also, it's only 6 weeks, just like in US. So Tamil Nadu is way ahead. Okay, ma'am. Thank you.
Thank you, sir. Thank you for that.
Yes, Dr. Tangam, sorry.
yeah, no problem. Dr. Kalyani, I just wanted to ask you, being a gynecologist, I'm more harping on the fertility aspect and all that of women. What is your opinion on egg freezing? You have been a mentor to many medical students. I learned from your talk. Have anyone opted for this? Is it quite common there in the US? How is it?
So, not, I mean, these medical students are still in their 20s. So, I haven't openly asked them about this, but on discussions with one of my friends, Marai's friends, 2 years junior, she was saying that it's becoming very common. Common, and also in California, in some states, it's they're all automatically doing it. But I haven't formally, because I'm not like a educator. I am just doing mentoring as passion, right? So I don't go into a lot of things. I just give them opinion, but I didn't collect that information, what they're doing. But that's becoming common. I'm hearing that because you have to find a partner. It's not like, back in 20 years ago, my dad said you have to marry. I'm sending you to the US, but within a year you have to marry. So those are things that are much more flexible now in terms, and there's all sorts of things. So that's that. What I'm hearing is that it's becoming the norm, and hopefully my goal is that it's not the norm, but that natural things should happen. So that's my thoughts.
Yes, thank you. Thank you.
Woody, you have your hand up. You want to say something?
No, only if nobody else has anything to say. I just wanted to say that, I am a huge fan of Kalyani and the way that she multitasks, which is just amazing. Uh, so having said that, I was just going back to something that Colonel Hari Krishnan said, which is basically that, just because a, woman is
You need to
expected
talk a little louder or come closer to the mic, Woody.
Oh, sure. Can you hear me now?
Yeah.
Yeah. Okay. Sorry. No, Colonel Harikrishnan said that, just because a woman is expected to take care of the home, that it should not preclude her from, going into a successful career in medicine. So that sort of is a very interesting thing. So having, raising a daughter who is a physician, it sort of is interesting for me to get all these inputs, right? So we have strived very hard, right, from the very beginning to not go into any sort of gender-based raising. So our expectations of our daughter would have been exactly the same if she were a son. So and while all this is great in theory, in practice, we also start thinking about things like, okay, how is this going to work with the future partner? I mean, if your interest in domestic activities is just as much as a male's, how is that going to work for a family life? So those are all things that you have to sort of negotiate. But having said that, I think it makes great sense. I do believe that what Kalyani said about the younger graduates from what Sharda had said about younger graduates today is absolutely true. These children are way more aware than we are, whether they are men or women. I just hope that the other point that Dr. Harikrishnan made, which is about dealing with gender-based biases and sort of doing away with them, will happen way more in that generation than it did in ours.
Thank you, Ravi.
Yeah.
Dr.
Hello,
Varun, you
Kalyani.
have your Dr. Varun, you have your camera on. Did you want to say something? Varun Agrawal?
No, that's it. Just very glad to see everyone. So,
Yeah, hi, Varun.
hi, Kalyani.
Hi, Varun.
So Varun is my classmate as well.
Okay.
And Jamya, you wanted to say something?
Jamyang also is online. Hi, Jamyang.
Yeah, hello, Kalyani. Yeah, just a parting note since I believe now the meeting is going to close. So, as a classmate, Kalyani used to be a classmate, and like Siva described, she used to be the real nerd. So, it was only during the clinics we would interact. So, after that, again, we would all we'd never be on talking terms. But then, from the little that I know of her, that I knew her, she was a very helpful lady, very sincere. She was an academician to the core and a very nice lady. And Kalyani, I think it's really truly moving to hear your story here. And, or should I say, Coach Nara, for all the things that you've
Coach,
been doing.
Coach Kalyani.
Yeah, okay. And your resilience, I mean, it's truly inspiring. I mean, especially coming out on top after everything that you've faced. Even for us here in India, I mean, where many of us we have this invaluable support of parents, relatives, and help at home. Raising a child can still feel like an uphill task, but then to do that in a distant country with four child, it's like nothing short of extraordinary. And then devoting that extra time to take care of your special needs child is like amazing. And also, apart from this, finding time to mentor the younger kids. I wish, I could put my child also, I could do a video call. Maybe you could mentor our kids as well. I really look forward to that as well. Okay, and all I can say at the end is, as your batchmate, we are very, very proud of you. And it was amazing talk once again.
Thank you, Jamyan.
Radhakrishna, would you like to come in? If anyone else wants to say something, please either turn your camera on or use the electronic hand raise.
Ma'am, I want to make 2 points.
Go ahead.
Okay. Ma'am, one regarding Dr. Tangam's question, ma'am. Actually, Kalyani's slide has one point where the last slide, I believe, the associations making some guidelines that it mentions that cryoprecipitation has to be subsidized. So I think in some part of the world, like the advanced developed world, they are trying to do something for the women doctors. One. The next point is what Colonel Hari Krishnan and the other doctor, senior doctor were telling, gender sensitization. So these days, the science textbook, ma'am, seventh class science textbook, talks about menstruation in the chapter called reproductive health. Reproductive health. So in our days, we never had. It was a taboo subject. Menstruation was a taboo subject. Here now, the boy student also has to write about menstruation, write about sanitary pads, write about programs, government programs where they distribute biodegradable sanitary pads and how to incinerate the sanitary pads. Those machines are available in the. All that is mentioned in that seventh class science textbook. So gender sensitization is happening. That's what the point I wanted to make. Thank you, ma'am.
Thank you, Shiva.
Ma'am, could I just say, I think,
yes, Gayatri, please.
A few months ago, I took part in a panel discussion on marvelous medicine on something similar about women. We were a group of 4 or 5 women. We shared our stories through our careers in medicine. And I think one important message, I forget who exactly brought it up, I think that resonates very well here as well, is the definition of success is different for each person. So I think it's important that we don't measure our idea of a successful career. Like you mentioned in the beginning of your training, you had this trajectory in mind of what it meant to be successful. But now 16 years later, you found your ikigai and you found your self-actualization. You found your true success. So it might not be the same recipe as someone else. But so I think that was a very important message that I really took from that discussion. And I think that really is clear. So you might not be as successful as, say, a classmate who's a professor, but in your own definition, you have reached your level of success. I think that's an incredible message. And thank you once again for your talk. It's really
yeah, thank you, Gayatri. Yeah, I didn't win a Nobel yet. I have like many years to win my Nobel, to work on my Nobel, right?
In medicine, physiology, or peace?
Or maybe literature. Who knows, Shiva? No, and you have to joke about things, right? I mean, at one point I used to worry about, oh, I didn't get this, I didn't do that yet, I didn't do, and after a while I'm like, wait, what's the point of that? Okay, what is winning a Nobel going to give me if I'm happy doing what I'm doing?
Can I make a point? Hello?
Sure, Sitara.
Kalyani, can you see me?
Yeah, I can't see you. Sitara, you my classmate, Sitara.
Sitara, you just turned off your mic, I think.
Yeah.
Video is not on, so we can't see you. Just
Yeah.
Yeah,
I am a batchmate from JIPMA, Kalyani.
Oh, yeah, Sitara. So without the last name over there.
Hi, Sitara.
Hi, Shiva.
Sitara.
Hi, Shiva. Such a pleasant surprise, to see you all here. And Kalyani, we have always known you as one of the most brilliant student of our class, Now, but after hearing this such a honest story of yours, so inspiring. I think, the way you have dealt your problems in life, hats off to you. And we are all so proud of you that you have come
Thank you,
out so
Sitara. It's so
wonderfully,
nice that
so
you're all
beautiful.
here.
No, it's so nice. And I remember now I'm actually an associate professor in medical college, government setup here. But when I was doing my DM in gastroenterology years back, it was such a struggle. And I was, the pregnancy and childbirth and the managing the DM degree during that period was such a difficult thing for me. And no, it truly resonates so many of I think many of us in this listening to you can actually resonate with all the problems that we have had during those years. But truly inspiring story, and we are all so proud of you.
Thank you. Thank you, Sitara.
Yeah.
I may sound not very pleasant, but I always was made to believe that successful women medical professionals are either spinsters, divorced, or painfully married. You know, here's an exception. You see, three parties are involved, Kalyani, in this. I'm married to a very, very celebrity surgeon, and this from the heart. I'm from a Telugu background, and you know how mothers pamper their children. The thing
Boys.
the thing I most used to like is my mother applying coconut oil to my head whenever I'm home. 2 days after marriage, I asked my wife, "Can you some apply coconut oil?" You know what she said? "Don't you have hands?" And thing is, the women suffer, especially when they rise. They think that the whole world is against them, and they try fighting that. The husbands, like no coconut oil, you use your own hands, that you don't apply at all, you leave it. It reflects in many other things. Children suffer. Children suffer, because away from maternal or whatever mother's care and all, and they grow differently. But you have broken all the shackles. The thing I liked most is you never said a word, even a word against your husband. Most women keep silent, but you didn't say a word, and that should get you a Nobel, actually, if at all. Now, your children have done extremely well. Kalyani, I strongly believe that your type of successful woman must be minuscule. Minuscule. If you take all the women, successful women put together. Of course, Gayatri's success differs from person to person, but then altogether. Now, with so many women coming into medicine, and lot of them are just remaining average, not good because of so many restrictions. There are very few like Gayatri and you cut the thing and break the glass and it's a lot of difficulty, and it's not at all easy, especially in India. Now, with this happening, all the young women who are joining medical profession are in for a shock, actually. At some point, they'll realize that, we can't go but beyond a certain point without getting into trouble. It's time people like you, or for that matter, all successful women medical professionals should have national, international conferences where you discuss how to become successful in spite of all this. Forget medicine, forget oncology, forget everything else, because the youngsters will get some idea. Nobody tells them anything. It's very sad that life is definitely not easy. In my case, I'm found fault with saying that I don't take care of anything. Children's education. This actually I'm not allowed. High power women would like to make all the decisions, and when you don't interfere, they said you're not making decisions. Life is not easy, I should tell you, because as a male married to someone successful, this is all like I think Vidya, you have to get a husband once on Marvelous Medicine and get to know. See, now the word regarding
the maternity leave, Vidya, I don't know about your hospital. Many corporates don't pay
I
salary.
said government. I said government because
70% of
government.
70% of Indian medicine is corporate.
Ah.
There, you are pregnant, it's your thing. No salary if you're salaried, and no money if you're not working. It's as simple as that. Life is not that rosy. So altogether, Kalyani, you are an exception.
Thank you.
And you should be a lighthouse or a beam for many more exceptional women like you, and they should know what all you went through. And it's such a wonderful story. I'll be very glad to write your biography if given a chance.
Oh, no, it's not. It's not. Yeah, it's not needed. That is not needed. But I am. Yeah, at some point, my husband actually said when I was reading all these self-development books, I think you should start writing something. So he also endorsed that about it. So I'm happy and I'm satisfied with that.
Vidya.
So Kalyani, you should take up our case offer when you win that Nobel.
And before that, perhaps your next visit to India, he can have a one-on-one chit chat with you. Akla, you had your hand up a couple of times. You wanted to say something?
All that I wanted to say is the common saying is that behind every successful man there is a woman. But I would like to say I would say that it is every successful woman has a man beside her. That's what gives it. It could be a spouse. It could be a.
Yeah,
It could be a
more
spouse.
than
It
one
could be
man,
a
I guess.
father. It could be a brother. It could be anybody. But somebody beside her to say yes, you can do it.
Absolutely.
That's all.
A dad, a colleague, it doesn't always have to be a spouse. I totally agree with that. It's great when it's a spouse, but we are lucky to at least have others like, dads, brothers, colleagues, even younger colleagues. Yeah.
And siblings, we saw it with Dr. Tangam.
Yes. Yes. So we are really out of time. So I'm sure Kalyani has to go back to her clinic or whatever. And Gayatri, I'm sure your daughter wants dinner. So we'll meet again next week with another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.